Hi friends, Marcy Schoenborn here of ShowFit. I'm so glad you're here with me today. And I'm going to be doing a series of talks for a while because there is so much misinformation out there. And, some of the talks I do will be simply explaining things better than what the social media post explain to make sure you're not harming your health in the process of following that post. Some of the posts will be actually debunking what they're trying to tell you or sell you. And so I hope that you tune into these talks. You can follow me at my school. There will be links to all the ways that you can find me around social media. But without further ado, let's talk about this recent post. So this is the post. Long-term melatonin use was associated with a higher risk of heart failure, according to a preliminary study announced this week by the American Heart Association. And this was a Fox News Milwaukee post. And what I did is went in and researched and got all the scientific data. So under this video, depending on where you're watching it, if you're watching it on YouTube, you will actually even be able to see the citations. You'll be able to go in and dig deeper if you would like to. I don't ever teach anything that isn't researched. So I don't get my information from other YouTubers, other social media people. So, but here's a detailed breakdown of what the recent preliminary study presented by the American Heart Association, the AHA, found about long-term use of melatonin, the hormone supplement often used for sleep, what the limitations are and what it doesn't tell us, so you can interpret the findings in context. And we also know a lot of those ads are just trying to reel you in so they can tell you more or sell you something. So I'm going to explain it all here. So what the study says, here are the key findings based on the information. The researchers examined health records data from a large international electronic health record database, the TriNetX Global Research Network. And they did this over 5 years. The studied group, adults diagnosed with insomnia, or with documented insomnia, and no prior heart failure diagnosis, no prior sleep medication other than melatonin use. Long-term use was defined as 12 months or more of melatonin documented in the records. Among the insomnia cohort, those with long-term melatonin use had about a 90% higher risk of being newly diagnosed with heart failure over the 5-year period than matched non-users of melatonin, 4.6% versus 2.7% in the primary match, but we're going to unpack that primary match. So secondary analysis, hospitalization for heart failure, users of long-term melatonin were nearly 3.5 times as likely to be hospitalized with heart failure related codes compared to non-users, 19% versus 6.6% in one analysis. All-cause mortality, those in the melatonin user group were nearly twice as likely to die from any cause over the next 5 years, 7.8% versus 4.3%. And here's the thing, even just throwing this little tidbit out there about all-cause mortality, if you've got a heart condition, heart disease is the #1 killer. Many other health issues lead into that. So maybe you are diabetic, maybe you've got NAFLD, maybe you've got kidney disease. The heart is usually what doesn't last. The heart is trying to handle all these organs, and it finally says, I can't do my job anymore. So that's why all-cause mortality, whenever we're discussing the heart, is higher. And the authors themselves note that the results are associations, observational, not proof of causation. So we're not even talking about cause here, that melatonin was the cause. We're talking about the associations. The AHA statement, melatonin supplements may not be as harmless as commonly assumed. If our study is confirmed, this could affect how doctors counsel patients about sleep aids. The sad fact is we know that doctors often push prescription sleep aids, and those are even worse than melatonin, hate to tell you. So, but what this whole ad, this meme didn't tell us. It's crucial to important to interpret these findings with caution. Some of the major caveats. It is not causation because this is observational using health records. We cannot conclude that melatonin caused the increase in heart failure risk. And the authors stress this. So the authors who published it stress that, but the news ran with it because the news loves that crap. So confounding by indication and residual confounding. People using melatonin long-term may have more severe insomnia, other sleep disorders, worse overall health, more comorbidities like anxiety, depression, cardiovascular risk factors, any of which could increase heart failure risk. For example, underlying poor sleep, it is itself a risk factor for heart disease. And so let's just even unpack why this would happen. So if you're using melatonin as a quick fix to sleep, but you're not changing your nutrition, you're not doing anything to help your body do its job. A healthy body that is fed properly will sleep better. Simple fact. I see it with clients all the time, hundreds of clients. So it's not a fluke. It's not just me, not just my husband who didn't sleep for about 2 decades until he started eating with me. Not a fluke. Over-the-counter melatonin use complicates classification. In many countries, like the US, melatonin is sold over the counter. So some non-users in the database may actually have used melatonin but not had a prescription recorded. This misclassification could bias results. So because this entire research was done based on results, not results that were recorded, and with limited questions asked of the patient, there's a lot of missing info here, a lot. And this is what we have to be careful of across the board with the nonsense we see these influencers post on social media. And if you're not familiar, there are a lot of big influencers being paid big dollars, tens of thousands of dollars by lobbyists for big pharma and big food. Okay. And then here's what happens. All the little influencers that want to be somebody go and mimic and make reels talking about what this doctor or that doctor said, not knowing that doctor was just paid $20,000 to say it. And this is a fact. Lobbyists can get a lot more bang for the buck with influencers than what they have to pay a politician. So please be wise. Please be aware of that because that is a fact. I am sent emails all the time being asked to market products and claim that I use them in my health. And when I write back and say, but I didn't use it in my health, or we don't care. If you claim you did, we will pay you. I don't work that way. Unfortunately, a lot of people do. So the dose, formulation, duration details, the study as described so far does not provide reliable data on exact doses used, purity of supplement brands, or other formulation details. Melatonin supplements vary widely in dose and content. Peer review and publication status. The results presented were from an abstract at AHA's Scientific Sessions 2025. They have not yet been published in a peer-reviewed journal with full data. The AHA notes this limitation, so that is noted in there. But of course, somebody read a tiny bit of information and ran with it. Generalizability. The sample is specific. Adults with insomnia, no prior heart failure, no sleep medication other than melatonin, and matched to non-users. The risk in general population or in younger health people is unknown. So they had nothing to compare it to. Mechanistic uncertainty. The biological mechanism by which melatonin could increase heart failure risk is not established. Ironically, prior research has often suggested beneficial or protective effects of melatonin in cardiovascular settings. So antioxidant, anti-inflammatory in animals and small human studies. So how do we interpret this and what might it mean? Given the above, here's how to think about it. This study raises a red flag. Long-term, 12 months use of melatonin in people with insomnia was associated with significantly higher rates of heart failure diagnosis, hospitalization, and death compared to similar people who did not have documented melatonin use. But it does not mean you must assume melatonin is harmful in all cases, or that melatonin definitely causes heart failure. And friends, I teach my clients how to eat food that has melatonin in it. But again, if you don't heal the gut, so everything in your body's working like a well-oiled machine, even that doesn't work as well as it should. So it suggests that if someone is relying on melatonin chronically for many months, it may signal that underlying persistent sleep disorder that needs proper evaluation, not just taking a pill, or potentially higher cardiovascular risk overall, either via the insomnia itself, comorbidities, other lifestyle factors. And here's the thing that people aren't recognizing. They're just all of a sudden throwing melatonin to the wayside because maybe they just saw this image or read or heard the article on Fox News. If we are relying on a quick fix, no matter what it is, and we are not repairing the body with food, then we risk throwing off our cortisol and our adrenals. Our body starts struggling. Certainly, this can cause health issues. So it underscores that even natural over-the-counter supplements are not automatically risk-free, especially when used long-term without medical supervision. And this, I kind of say medical supervision tongue in cheek because I don't know how many times I've heard from clients that I have, we go over their labs, we put together a profile of what they can do to improve their labs. Maybe they've already been eating with me or they're newly to eating with me. And I won't out of the gate suggest medication, or I'm sorry, supplements. I can't suggest medication. But I won't out of the gate suggest supplements. Anyone doing that to you is doing you a disservice. We've got to get your food right for 90 days. But here's the thing as well. What I will do when we know, okay, maybe these supplements could improve and get your blood work even better. So then eventually the doctor is going to have to take you off medication. And why do we even want that? Because we want to preserve the liver, kidneys, pancreas, all the things that the medication is damaging. And I don't know how often I've put together a plan and the doctor doesn't know what the heck we're talking about. So what you really need to know is, do the supplements or herbs and spices that you want to use, do they correlate or can they be a problem with the medications that you're on? That's something I help figure out as well. So for healthcare providers, it suggests a need to ask about sleep aids during history taking, consider the broader cardiovascular risk profile in those using melatonin long-term, perhaps review whether the indication for chronic melatonin is appropriate, and whether alternative or adjunctive therapies for insomnia might be better. And so my suggestion would be better nutrition, of course. For individuals, if you're using melatonin nightly for many months, years, this might be a good time to review the reason. Is the insomnia new or chronic? Has sleep hygiene or other sleep medicine been tried? Assess cardiovascular risk. Do you have high blood pressure, diabetes, obesity, prior cardiac issues? Talk to your healthcare provider about whether continued melatonin use is appropriate or if evaluation of your sleep disorder and heart health is warranted. Not abruptly stop if it's been helpful and prescribed, but have a thoughtful discussion. And so some numbers to even keep in mind. Incidence of heart failure diagnosis over 5 years, it was 4.6% in long-term melatonin group versus 2.7% in non-melatonin group. Again, without all of the information needed to actually prove the research. Hospitalization for heart failure, 19% in melatonin group versus 6.6% in non-users. And that's in one of the analysis, but a question to be asked, the health level of those 19%. Were they morbidly obese? Did they have type 2 diabetes? Did they have high cholesterol? Did they have high blood pressure? There are more factors involved than melatonin use. And then all-cause death, 7.8% in melatonin users versus 4.3% in non-users over the same period. But again, same questions asked that I just asked in the prior statement. So what do we still need to know? Missing information that does matter. Randomized controlled trials. Those have not been done, or prospective cohort studies with detailed melatonin, dose, formulation, duration, and monitoring of heart outcomes to help clarify causation. Mechanistic research. How might chronic melatonin supplementation affect the heart and whether certain populations are more vulnerable? Subgroup analysis. Are the risks higher in older adults, people with pre-existing cardiovascular risk, those on certain medications? So all of those things should have been part of the research. The role of underlying sleep disorders and their management. Could poor sleep rather than melatonin be the key driver of the risk? Assessment of over-the-counter use versus prescribed use. Since many melatonin users are over the counter and medical records may miss this. And unfortunately, many people that are on medication just think they can grab things over the counter and they won't hurt them. And then we also have this misinformation of we can take more of things. Well, it says I should only take this much, and this much is working this well, but maybe if I took more, it would work better. And there's dosages listed for a reason. So I just wanted to make sure that I got all these important points out to you. When you see these memes that are going all over social media, various social medias, or you hear reels that give you a scare, you can bring that information to me. I will do a deep dive and I will explain it. So we don't have to run around being scared of the noise. There is so much noise out there, and that's why I wrote my book, Stop the Noise. So if you like this, please share it, tell friends, subscribe to my channel, because there's going to be lots more where this came from. Fortunately for me, all of the people that are posting this nonsense are keeping me busy. So be blessed. I'm so glad you were here with me. Have the most amazing day. This day was made for you. You got another chance when you woke up this morning. Go run with it big. And I'll tell you what, feeling healthy makes all the difference in the world, and that's what I can help you with. Have a great day.